Hi, I'm Dr. Yeshwant, Director, Atharva Infertility Centre, Nasik. I'm a practicing IVF specialist since last 15 years. Today we'll be discussing upon a very curious topic, why there is increased incidence of twins or triplets during an IVF treatment. For that, we need to understand a normal physiology of the female reproductive system. Now, all of you know, every female produces only one single healthy egg during her menstrual cycle. Now, this egg on 14th or 16th day of the menstrual cycle is ovulated, and this egg is captured by the fallopian tube. The sperms which are deposited in the vagina, they ascend into the uterine cavity, and the sperm and the egg meet in the ampullary portion of the fallopian tube. Here the embryo is produced, and this embryo cleaves or develops every 24 hours. Finally, the embryo migrates into the uterine cavity and it gets attached in the uterus, and the baby is developed in the uterus. So this is the normal physiology. So it will be easy to understand what different we tend to do in IVF and why there is increased incidence of twins or triplets following IVF treatment. Now, in IVF treatment, a clinician usually expects that a female should produce around about 10 to 12 eggs. How this is achieved? This is achieved by giving certain injections from second day of the menstrual cycle, and these injections are called as gonadotropin. Now, dose of the gonadotropin differs from patient to patient, which is calculated on the age of the patient, the antral follicle, and the weight of the BMI of the patient. Now, these injections are given for the first 5 days. On a 6th day of gonadotropin stimulation, an ultrasound scan is done to assess the response to gonadotropin. If the response appears to be satisfactory, one more injection of antagonist is added, and these injections are continued till the egg matures or egg reaches a sufficient size of 18 mm. On that evening, a trigger injection is scheduled, and 35 hours after the trigger, the ovum pickup is done under short general anesthesia in the operation theatre. So when the clinician extracts the follicles, he expects that he should have at least 8 to 10 good quality eggs. The intention of getting so many eggs is to fertilize them with a husband's sperm and produce multiple embryos. If multiple embryos are produced, then we have a wide range of selection so that we have good quality embryos for transfer. A selection of the embryo for transfer is usually done on either day 3 or day 5. So if you are doing a day 3 transfer, which is usually 8 cell and above stage of embryonic development, we tend to transfer maximum 3 embryos. So theoretical possibility is that all the 3 embryos could attach and it can have a triplet pregnancy. Some cases, there is a good possibility out of the 2 embryos will attach and she will have twin pregnancy. Some cases, a single embryo is attached and it forms a singleton pregnancy. And few cases, we transfer 3 embryos and still none of them attach. This is called as the IVF failure cycle. So how these embryos are selected for transfer? On day 3, the selection of the embryo is grossly based on the morphologic appearance of the embryo. That embryo has to be 8 cell, 8 cell stage. All the cells, they have to be of equal size, they have to be very tightly arranged, there should be no fragments in the embryo, and the zona should be thin. So if you transfer 3 embryos, there are definitely chances of triplets are present. In some cases, we tend to do extended culture. Extended culture is called as day 5 transfer. That is called as blastocyst transfer. When you tend to do a blastocyst transfer, you tend to grow these day 3 embryos up to day 5 in a separate culture media in the lab. Now these blastocysts, they are the most tough embryos, and on day 5, we again assess the embryos morphologically. So if you transfer 1 or 2 blastocysts, chances of pregnancy are slightly higher, and if you tend to transfer 2 blastocysts, chances of multiple pregnancies are definitely on the higher side. So after the embryo transfer, the patient is prescribed certain medicines called as luteal phase support, and 15 days post transfer we tend to do a blood test for diagnosis of pregnancy. After the pregnancy is diagnosed, after 15 days we do a viability scan to assess how many embryos have implanted, how many G sacs are seen, how many sacs with cardiac activity are visible. Suppose if you have done a day 3 transfer and you tend to see like 3 G sacs with good cardiac activity, still it's not assured that she will have triplets. So you tend to do a repeat scan after 1 month, and in some cases, if there are 3 pregnancies, if one pregnancy is internally weak, that pregnancy stops to grow, and the rest 2 pregnancies which are healthy, they tend to grow. Even if one sac or one pregnancy stops growing, it doesn't have any harmful effect on the remaining 2 healthy growing pregnancies. If you do day 5 embryo transfer, if you again assess the pregnancy on the viability scan day, if you have 2 pregnancies, if you have transferred 2 blastocysts, there are possibilities that both of the embryos could have attached. So it is not until 10 to 12 weeks of gestation the patient can be rest assured that both the twins are healthy. Suppose in very few cases all the 3 G sacs are healthy and they have a good cardiac activity, then it is very difficult for the patient to carry twin pregnancy till delivery. Like we have in the previous discussion, we had said the nature has made a uterus to accommodate a single baby. But with advances of science and technology, we tend to grow 2 or 3 fetuses in the uterus. So the capacity of the uterus is not made for carrying twins or triplets. Carrying twins can be managed in majority of the cases, but carrying triplets till 9 months, it has its own complications. Complications like bleeding in pregnancy, miscarriages in pregnancy, premature delivery, low birth weight babies, and other maternal complications. So we at Atharva Infertility Centre, we strictly advise the patients not to carry triplet pregnancy. If by 10 to 12 weeks, if triplet pregnancy is diagnosed, when all the 3 sacs and 3 babies are healthy, we do selective fetal reduction. So we tend to inject one particular injection in the heart of the baby and we stop the heartbeats. By doing so, there is usually no harm to the other 2 sacs. And if one heart stops, this baby compresses in between the growing babies, and finally the patient can deliver twins at 37 weeks. The other complications of multiple pregnancy, there are increased incidence of hypertension in the mother, increased incidence of gestational diabetes, and after delivery, chances of postpartum hemorrhage are very high. So we have to be very careful depending upon the patient's medical condition. Patient's age is the most important factor, whether she can carry twins till 37 weeks. Still, if you have any questions regarding multiple pregnancies following IVF, please do write to the numbers given below or be free to call, and we'll be happy to answer your questions. Thank you.